If a woman is diagnosed at a young age with cervical cancer, it raises the question about her chances of getting pregnant. Well, in today's Women's Care Wednesday segment, Dr. Jessica Stein from Women's Care Florida joins us here again to discuss the options she has. Good to see you again.
Good to see you. Thanks for having me back.
So this is so interesting. I'd imagine this is a question that you get asked a lot because cervical cancer, unfortunately, is still pretty common.
Yeah, and cervical cancer is a young woman's disease. Yeah. And as we're noticing, women are starting to have pregnancies and babies later in life. And so unfortunately, cervical cancer is becoming much more prominent in that population. And a lot of the conventional treatments to treat cervical cancer, like hysterectomy or radiation, unfortunately eliminate the possibility to become pregnant. So women are really searching for options that might allow them to retain their fertility.
Well, and let's talk about what those options are. And I'm so glad that you're here to talk about what your specialty is, because from what I'm learning is not all offices, you know, around the country have this. I mean, this is truly unique that you're able to offer this. So talk about the options.
So if a woman comes to my office, she'll have to have an assessment.
Okay.
We will diagnose her cancer and perform an examination on her. And what we're doing is we're searching for possibilities of how we can treat that cancer.
And most stages, they hopefully, thankfully, I feel like we are catching it earlier now, which is ideal.
It is, of course. And if women are going to their regular well woman exams and having their Pap screening, if they are going to have cervical cancer, generally speaking, that cervical cancer will be caught early and there will be options available to her.
All right. So they come and see you, you get it diagnosed to figure out what stage.
So we actually stage cervical cancer in the office. So one of the most important points is doing the exam. And deciding on if they can have fertility sparing treatment is really surrounded by, is the tumor confined to the cervix? What size is it? This sounds obvious, but do they want to have children in the future? You know, because the fertility sparing option for cervical cancer is very complex, and doing that surgery is very complex. And the more traditional options are not as invasive and complex. So you have to have that conversation with the patient if that's really, you know, something important to them.
Talk about the specific surgery that really you have been trained. Again, what I'm learning from you, very unique.
Right, yeah. So the specific surgery we're talking about today is what's called a radical trachelectomy. So this is a procedure where instead of doing a complete hysterectomy, removing the uterus and cervix, we actually can just remove the cervix with the cervical tumor, leaving the uterus, ovaries, and fallopian tubes all behind.
So you can still have the chance of getting pregnant and have a completely normal pregnancy after that.
Absolutely.
Wow.
So what we do during that surgery is actually very carefully dissect the blood vessels that feed the uterus, and we spare those vessels. But at the same time, they need an oncology surgery, so they have all the tissues around the cervix and the cervix itself removed, and that gets actually reattached to the top of the vagina. And then that way, patients can actually end up even conceiving spontaneously.
And not all practices are doing this particular type of surgery. I want to make sure that, I mean, this is what you've trained for, you know, for many years.
Yeah, I mean, you know, radical trachelectomy is still a pretty rare procedure. There's very few institutions in the country that can perform it. So it's important when patients are thinking about this option that they talk to their GYN oncologist and make sure that they have had specialty training to perform the procedure.
All right, well, as we close here, I think that's just more importantly, though, to make sure that women are getting these Pap smears as well.
Absolutely.
As early and often as they can, and making sure they're checking in with their doctor. Thank you so much for being here this morning, talking about these options. There's the contact info there. If you have any other questions, the number and the website as well. Thank you so much.
Thanks for having me.